Hello, it's around 5 p.m. here in Seoul. I'm Mark Broom at Arirang TV's News Centre. We're breaking into our regular programming for a live briefing from the South Korean health authorities on the COVID-19 situation here in the country. They're just preparing to start the briefing now in just a few moments. Let's pass it over to our interpreter.
존경하는 국민 여러분.
Honorable citizens, I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Gov't. Today, with regards to COVID-19, I want to explain to the citizens the severity of the situation, and I want to make a request to you. Over the past week, the number of confirmed cases were close to 500. And when we compare this to the previous 10 weeks, which were fluctuating at around 400, we are seeing a clear increase, and reinfection rate is also greater than 1, which is showing that there is a spread of the infection. We are seeing the spread across all of the country, and we are seeing the infection in many of the areas in our daily lives, and it is difficult for us to actually pinpoint exact places where infection is coming from. And when we see the numbers are increasing in both the metropolitan and non-metropolitan area, and there were also some non-metropolitan areas that actually elevated the level of social distancing measure. And last week, we have seen 41 variant COVID-19 cases, and we are seeing that there are more numbers coming in, and across the world we are seeing an increase in the number of patients with the variant form of COVID-19, and we are also seeing the spread in UK. When we look at the past year, we can say that the current situation is similar to a level where we are just before a massive outbreak. So right now we are at an inflection point before the start of the fourth wave of resurgence. Right now, we are seeing around 500 newly confirmed cases every day, and if it spreads, that means that in a very short amount of time, it could become massive. In preparation of the fourth wave, we increased the number of capability and capacity of testing, and we actually doubled it, and we increased the number of hospital beds too. However, this is a preparation for just in case. If we were to see another resurgence, that means that the government will have to elevate the level of social distancing measures, and that means that we will face even more difficulty. Right now, spring is coming towards us, and as the weather gets warmer, there are more movements among people, and there are increasing contact amongst people as well. So we may say that this is because spring is coming to us. However, we cannot explain that to the viruses. Viruses will spread regardless of the situation, and it is not giving us any room. Over the past year, we have already experienced it, and the lessons that we learned and that the world learned is all the same. It is that the fight against COVID-19 is not at an end until it is actually ending, and we have to make sure that we are responding to it with seriousness until we are fully vaccinated. Right now, we are seeing another sign of spread. Therefore, we have to be especially careful right now. As we are approaching spring, please refrain from going outside, and please remember infection first. Please make sure that you're not getting tired for yourselves and for your family members. If we actually losing ourselves here, that means that our spring may be more difficult than the spring that we faced last year, and the situation has not ended yet. April is also a very important period where vaccination will start in earnest. We have already started vaccination for those over 75 years old, and within the months we will start vaccination for those who are 60 years or older. And we're going to go ahead with vaccination for the high-risk groups. Once this is completed in June, the risk of COVID-19 will decrease greatly. there will be
중환자와
less
사망자와
risk
사망자가
in the
감소할
long-term
것입니다.
care facilities
그러나
and in
여기서
the medical
상황이 더
centers, and we will
악화되면
see a decrease
방역
in
분산으로
the number of
예방
deaths as
접종도
well. However,
차질이 발생하고
if the situation becomes worse
늦춰질
than
것입니다.
that we have right
많은
now, that
국가에서
means that
예방
everything
접종을
will slow
시작하면서
down. A lot of
긴장감이
countries
저하되고
are
재유행을
starting
겪고
vaccination, and this
결국
is leading to
고통스러운
people
재봉쇄에
becoming
돌입하고
more
있습니다.
lenient, and therefore
우리는 이를
it is leading
반면교사로
to
삼아야
another
합니다.
wave of
예방 접종이
COVID-19. We
진행
have
중이
to learn
괜찮다가
from
아니라
this lesson.
그렇기
We cannot
때문에
say
오히려
that it's
더
okay because we are starting with
감염으로부터
vaccination.
안전을
We have
확보해야
to say
합니다.
that it is
우리가
especially
여기서
important
심기일전하여
for us
밀집,
to prevent against
밀폐,
infection
밀접 상황을
because we are
적극적으로
starting
줄여 없애나간다면
vaccination.
예방
Let
접종
us
효과를
actually
조금이라도 더 빨리
decrease
더
the
크게
number
누릴 수
of
있습니다.
contact
정부는
within
국민
the
여러분들께 4월
crowded
한 달간
and
다음 세 가지를 꼭
confined places.
지켜주시길
So we
호소드립니다.
ask our citizens to
첫
remember
번째로
this in April.
언제 어디서든
Please
내가
remember
방역의
that
최일선 주체라는
you
생각을
are
가지시고
the prior member
기본적인
for disease
방역
control
수칙을
wherever you are,
지켜주시기
whenever you
바랍니다.
are. So we ask you
마스크
to
착용,
practice
손 씻기,
frequent hygiene
주기적인
and
환기
also disease
등과
control measures. Please
증상이
make sure to
있으면
wear
검사를
face
받는 것
masks
등입니다.
and wash your hands
기본적인
frequently,
방역
and
수칙은
also
어렵지
ventilate
않습니다.
and be
그러나
tested when you have
코로나19 감염
symptoms.
위험을
This is
크게
not something that is
줄여주는 가장
difficult to
효과적인
adhere to.
방법입니다.
However, it is actually
특히
one that
발열,
is the most
기침,
effective
근육통
to
등
prevent
의심
yourself
증상이 있는
against
경우
COVID-19.
많은 사람이
And if you
모이는
have
곳을
coughing,
방문하지 말고
fever, or other
코로나19 검사를
symptoms, please
받아주시길
refrain from going
바랍니다.
to places where a lot of people are
최근 많은
visiting,
환자가
and please
발생하고
be
있는
tested for
유흥업소,
COVID-19.
노래 연습장,
Recently, there has
방문
been
판매업,
spread in
실내 체육시설,
multi-use facilities
교회
such
등의
as sports
관리자와
facilities,
이용자들께도 당부
churches,
말씀드립니다.
and in
이들 시설은
the
감염 위험이
other
높은
entertainment
시설들입니다.
facilities as well.
운영
So
시간
we
제한이나
ask you once
집합
more,
금지를
please
풀었던
make
것은
sure that
철저하게
you are
방역
compliant
수칙을
to all the
지키겠다는
measures.
자율적 노력을 믿고
We
방역
actually
조치를
trusted
완화한
you
것입니다.
enough
그러나
to
최근
believe that
다수의
you will
집단 감염
follow
사례들에서
the
방역
measures
수칙 위반이
voluntarily,
나타나고
and that is
있습니다.
why we have eased the measures
정부는
for you.
감염
However,
사례가
we
많은
are
시설들
seeing
중심으로
cluster
대대적인
outbreak in these
현장 점검을
multi-use
강화할
facilities.
것입니다.
The government will
위반 업소에
strengthen
대해서는
site
무관용
monitoring
원칙에 따라
for
엄벌에
these
처할
areas where
것입니다.
we see an
이런
increase in
위반이
infection, and we
다수에서
will not
발생하는 경우
tolerate.
해당 업종에 집합
And
금지를
if there are
실시하거나 운영
infections
제한을 강화하는
because
조치도
there were
실행할
rules
것입니다.
that were being violated, then we will
내일부터는
be strengthening
일주일간의
the
계도 기간이
measures.
끝나고 업종별,
Tomorrow is an
시설별로
end of
세분화된
the
기본
inflection
방역
period
수칙이
that we have
본격적으로
seen, and we
의무화됩니다.
will be putting
다중시설의 관리자,
a mandatory disease
이용자들께서는
control measure
우리 모두의
on some of
안전과
the
일상의
facilities.
회복을
Therefore, we
위해
ask
방역
the
수칙을
facility
철저히
owners
지켜주시길
and
바랍니다.
operators to adhere to the measures so that we
국민들께 드리는
can
두 번째
maintain
요청
safety
사항,
of ourselves
꼭
and
필요하지
those
않은 모임은
around us.
취소하고
And another
만나는
request
인원을
to our citizens,
줄여주시라는
if you
것입니다.
have appointments,
많은 모임에
unless it is
참가하고
absolutely
다양한
necessary,
사람들이 모여
please cancel it,
식사나 음주를
and please
하며
refrain
마스크를 벗게 되면
from having
감염
gatherings,
확률은
because if you
비약적으로
have
높아집니다.
gatherings and if you have meals with
지금은
others
일상
without
생활의 모든
wearing your
장소가
mask,
코로나19
this means that
감염에
there will be
위험해지고
an
있습니다.
increase in the
작은 규모의
possibility of
비모임에서
getting
시작하여
infection. Right now, we
가족과
have to be
다른
especially
지인들에게
careful
감염을 전파하는
because
경우가
there are
가장 많은
infection
비중을
that is
차지하고
spreading
있습니다.
through small gatherings
국민
and spreading
여러분들께서는
onto
가능한
other family
모든
members,
모임을
and which
줄여주시기
is becoming a
바랍니다.
chain
특히
reaction. Therefore, we
밀폐된
ask
실내에서
you
모임은
once
피해주시고
more to
불가피한
refrain
경우
from
방역
having
수칙을 잘
meetings
지켜주시기
or
바랍니다.
gatherings in
마지막 세
confined
번째로
spaces. And please
예방접종
make sure to cancel
대상자들께
these gatherings unless it is
적극적으로
absolutely
접종에 동참해
necessary.
주실 것을
And we
요청드립니다.
also ask
백신을 통한
all the
집단 면역
citizens
형성은
to actively
나와 우리
participate in
가족, 우리
vaccination.
사회가
Through
코로나19의
vaccines, we will
위험을
be able
극복하는
to
거의
protect
유일한
ourselves,
방법입니다.
those around us, and our family
특히
members from
상반기까지
COVID-19. And it is the
코로나19
only
감염
way
치명률이
to
높으신
protect us.
어르신들과 취약계층,
And especially
필수
for
인력들이
those
모두
who
예방접종을
are
받게
more than
된다면
75
우리
years old,
사회는
and the elderly,
코로나19로부터
and
훨씬
the
더
required
안전해질 것입니다.
personnel and staff members, we
세계적으로
have to
이미
make sure that these
수억 명의
people are
사람들이
vaccinated there,
예방접종을
because
받았으며
only then will we
안전성과
be able to
효과성은
have a safe
이를
environment.
통해 충분히 입증되고
There
있습니다.
were millions of people
본인의
being
안전과
vaccinated across the
우리의
world,
가족과
and we
이웃을
believe
위해
that it may be
예방접종을
safe.
적극적으로 받아주시기
We ask
바랍니다.
all the citizens
가족들
to
중
be actively
예방접종 대상자가
participating
있는
in
경우
vaccination.
적극적으로 권유하고
Within your
도와주실
family
것을
members, if
당부드립니다.
there are those who are
지금
at the
우리
period
앞에는
for
갈림길이 놓여
vaccination,
있습니다.
please help them
다시
actively.
지난 겨울과
We
같은
are at a
위험을
crossroads
접어들지
right now.
코로나를 이겨내는
It
길로
is at a
접어들지
crossroads where we have
이것은
to
국민
see
여러분의 참여에
if we're going
달려
to
있습니다.
have the result that we saw
지난
last
1년간
year,
우리
or
사회가
we will be able
코로나19로부터
to see a
상대적으로
decrease in the
안정적일
number,
수
and it
있었던
is up
것은
to you.
국민
Until
여러분들께서
now, we
높은
could have
시민의식으로
a stable situation because our citizens were actively
지난
participating in
1년간
disease
보여주신
control
모습처럼
measures. Please
기본적인 방역
make
수칙을
sure that you
지켜주시고
demonstrate what you have
모임을
shown over the
취소하고
past year.
예방
And
접종에
please make
참여하여
sure to cancel
코로나19를 이겨낼
gatherings
수
and
있도록
participate
다
in
함께
vaccination
협력해
so that we
주시기를
can all
당부드립니다.
overcome
정부도
COVID-19
국민
together.
여러분들께서
The
하루라도
government
빨리
will also strive
소중한
hard
일상을
so
되찾을
that
수
our
있도록
citizens
최선의
can
노력을
resume
다하겠습니다.
their daily
감사합니다.
lives as soon as possible. Thank you.
예, 이것으로 담화문 발표를 마치겠습니다.
And this will be the end of our
Okay, well, we've just been watching the South Korean government's briefing on the COVID-19 situation here in the country. They described it as being at a crossroads right now. Just a reminder that South Korea reported 543 new COVID-19 cases on Sunday. This brings the total number of cases in South Korea to almost 106,000. There were 4 more deaths as well, increasing the total to 1,744. And that's where we're going to wrap up our coverage of this briefing right now. We'll be back in around an hour's time with our evening newscast. Until then, bye.
From diagnosis to treatment, Korea's effective quarantine system is receiving global spotlight. K-quarantine has set an example for disease management, and many countries around the world are seeking Korean quarantine